This is a hot topic too, expanding our hygiene service mix. At Inspired Hygiene, we work with teams every single week on expanding their hygiene service mix. And sometimes they know exactly what to do, but they have some obstacles in their practice that they really need help overcoming. And they find it very helpful to have a coach, a facilitator to really help guide them. Um, to implementing new services in hygiene, knowing how to speak to patients about it, what's out there. One of the reasons I'm here at Yankee is to just really try to stay on top of what's new, what's available. And I just love learning about new things and trying them out myself, honestly, from a clinical standpoint, and then also sharing them with our clients. So thank you guys so much for being here. It's going to be, I think, a full house tonight. We had almost 350 people register for this event, so we're expecting a great turnout, and just thank you guys for being here. So what we're going to do is we are going to share a lot with you. So that's why I wanted to go ahead and just get this ramped up. We're going to talk about a few new innovative products that you may or may not have heard about and some of our experience with implementing those. We'll give you some insight into how to add services, clinical services specifically, so that they stay in place. So many times we get excited about a new product and we try it, and either we hit a barrier or somebody says no to it, or we just get busy and either we never get to implement it, or we start it, but then it kind of fades away. So how do we get things to really stay in place? We'll give some communication tips so patients don't feel like they're being upsold. And we'll talk about time management, workflow strategies, give you some real life examples. And at the end, we'll share, some before and after schedules with what does it look like when we have a limited hygiene service mix versus when we have a very robust toolkit of services and clinical care that we can provide for our patients. So just want to ask everybody again to please just make sure that you're muted unless you're ready to ask a question, just so we can have a good kind of quiet space for everybody to learn. So I want to make sure and introduce, and I know that Catherine's on as well. I can't see everybody that's on, but I want to introduce Jennifer Stedman and Kelly Hemrich. Kelly is a lead hygiene productivity coach with Inspired Hygiene. And Kelly is going to be sharing some of her experience with coaching clients to implement some of these specific products that we're recommending and that we are sharing with you. This session is not sponsored. Actually, at this point of recording of this, we don't have any type of official financial arrangement with these companies that we're sharing with you. Some of them we've had sponsorship with in the past, but this particular session isn't sponsored. And we do that on purpose because we want to be able to speak freely and just share really good, solid information based on our experience working with, hundreds of practices across the country and what they're seeing and what we are seeing. So thanks, Kelly, for being with us. I appreciate you so much, and thank you for taking time to share tonight.
Thank you.
Jennifer Stedman is with us. Jennifer is our Director of Operations. She's kind of running the behind the scenes of the session tonight, and she's going to share with us as well some insight on a couple new things you need to be aware of. I believe Catherine Gilliam, one of our lead coaches, is with us as well. And again, I cannot
thought
see
I saw
everybody.
Connie.
I
thought I
was
saw
wondering if
Connie.
Connie might be with us too. And Connie's one of our coaches with Inspired Hygiene as well. So they're just great resources if you ever need to reach out to them with questions specifically. All right, so let's go ahead and get started. So one of our core beliefs at Inspired Hygiene with regards to how we coach our clients is that patient outcomes drive business outcomes. If we are taking amazing care of our patients, if we are being innovative, if we are continually learning and implementing, evidence-based products and services for our patients, then it is going to just naturally create positive business outcomes. And so you'll see that our primary focus is going to be on patient care. But then obviously we're going to highlight at the very end how that might translate into business outcomes for you. So that is something that we very much believe. And we also believe that in order to set up a great environment for expanding hygiene in whatever direction you're going to go there, whether that is adding hygienists to your group, adding services, refining your current protocols, whatever that might be. A growth mindset really comes in handy. A growth mindset is going to really position you in a very positive manner to continually grow and learn and up level your service to your patients. And here's the thing, we believe that everything that we recommend and that our clients are implementing must be a win for the patients, the providers that are actually doing the service, and the practice as well. So we find that when the whole team has a growth mindset, it makes all these things so much easier. And we really encourage you, practice owners and practice leaders, to really set a culture that sets an expectation for a willingness to learn and grow and have this growth mindset. You know, it is uh, it happens more often than I would like that we speak to a practice owner or practice leader about potentially working with Inspired Hygiene to coach their hygiene department. And we hear all too often, I have a hygienist that's resistant, or I have a hygienist that's just not willing to, get out of their comfort zone. And it's tough. It's tough for the practice leaders to overcome that. I will say, I feel like the majority of the time, our inspired hygiene coaches are amazing at really motivating and engaging and empowering, teams, and the vast majority of the time those hygienists come around. But one thing that really helps is when the leaders in that practice have really set an expectation that, this is part of our culture, is that we are always going to be stepping out of our comfort zone in order to better serve our patients. And so the growth mindset is just an amazing foundation for elevating the hygiene department, elevating every piece of the practice, and expanding the hygiene service mix as well. So I came across this article, and Jennifer's going to drop a link to this article in the chat. I would encourage you to click on that or copy it for later reference. I came across this several years back, and I thought it was just fascinating. And I will just, highlight a few of the points here and how they really apply to dental teams, because we see this all the time, right? 10 reasons people resist change. There's another article that she'll share with you too, of why employees are resistant to change. And, I think that all of us are resistant to change to a certain extent in specific parts of our lives, right? And what I've found in my personal life, I've experienced a lot of change. I was doing a little purging at my house recently, and I counted up the number of places I have lived in. 18 different homes or apartments over the course of my life before the home that I've lived in now for 20 years. So, when I was in my 30s, I had lived already in 18 different places. And I'm sure that a lot of you could say the same, right? Whether it's 18 different cities, you were moved around a lot as a child, or it might just be 18 different, homes or apartments. But what it did for me is it helped me be really adaptable. It helped me be very flexible. And, there are things that I hold on to, but it's allowed me to understand that life is about change, and that a lot of times those changes can be positive. But employers or leaders and team members don't always view change the same, right? Practice owners, a lot of times you see change as a way to continually up level customer service, what we're providing, what we can share with our community, or how we can position ourselves in the community as a dental business, and how it drives the success of that business. Well, sometimes team members don't see it that way. Sometimes they see it from their perspective, maybe as a disruption. Things are fine. Why do we need to change? Why do we have a coach coming in? Why are we adding another service to, our hygiene service mix? Everything is fine. It's going along just fine. But so it's important, I feel like, for team members to really have some clear communication from leaders to help overcome some of that resistance. Part of it is uncertainty. Um, Remind your team, I'm speaking to the leaders now, remind your team what you're committed to, right, in your practice. What are your core values? Those are things that you want to really bring up on a regular basis. What are your core values, and how is refining your protocols consistent with your core values? If you have one that we're going to continually be the best dental practice in our town, then that means we've got to be willing to embrace innovation, new technology. And I will tell you that right now, there's more new products and new technology than I've ever seen in dentistry in my 30 plus year career. So there's a lot out there and it's super exciting. Um, the other thing that is a reason that a lot of times folks are resistant to change is they feel like they're losing control. A lot of times hygienists feel like they've got everything under control. They've got a really good system in their hygiene department. And now we're adding something new and I feel like it's out of control. I don't know how to manage my time, with this new protocol. I'm not sure what this means. How do I talk to my patients about this? And so they feel like they've lost control. So let the team know that this will be a collaborative process. We're going to talk about standards of care tonight and how to integrate, new services into your standard of care. And that has to be something that is a collaborative process. It's not something that is a mandate, from the dentist of, hey, we've got to do things this way. Certainly, the practice owner, the clinical leader, it has that final say in what it is that you're going to be offering to patients. But work with your team on this, collaborate, and let them know that you're not going to be giving them awkward scripts that you have to say things a certain way or blanket recommendations for every patient. Right? This is going to be we're going to recommend these products as they apply to these patients. A surprise, right? Good surprises usually come maybe around the holidays or if you win the lottery. Otherwise, there aren't always surprises aren't always positive. And so sometimes, somebody on the team will go to a conference and they'll come back and say, hey, we're going to incorporate, Curidont and it's going to be amazing. And nobody else had any say in it. And so it feels like a surprise. And all of a sudden, I'm supposed to embrace this. So rather than coming back from an event and communicating to the team, hey, we're going to do this, maybe talk about or maybe use the term, let's explore this. I found out some really great information and some new products that I think could address some of our patients' problems. So let's explore these together and let's figure out which ones seem like a great fit. And then let's go ahead and, figure out a way to get started where we all feel comfortable with that. Same with, if you're talking about working with a coach. We give specific guidance on communication with the practice leaders that decide, hey, it's time to work with Inspired Hygiene. We give them some guidance and some resources to know how to positively present this to their team so the team feels supported and not surprised, right? The other thing is, too, sometimes team members feel like, well, this is going to be a lot more work. I'm already doing as much as I can in the time that I have with my patients. How am I going to add one more thing? And there's some truth to that to a certain extent, right? And so what we have to figure out is how can I integrate these services into my work, and how can I really look at my time management so that these new services create energy and they create positive results for the patient. And we see all the time that new services and bringing new things into the hygiene department can really energize the hygienist. Um, and then also loss of face. This is really interesting and something that I think a lot of team members might not verbalize very often, but they feel this, emotionally, is the feeling of, gosh, what are my patients going to think if, I've never recommended periotherapy before and now I'm telling them they have active periodontal disease. So just remember, we do the best we can with the information that we have. And when we have new and higher level information, then we can care for our patients better. Holding back treatment because we're afraid the patient's going to think we haven't treated them well in the past is not doing the patients any favor, right? It's more about our ego than it is about the patient. But it is a real concern, and it is something that's really important to be addressed when we're looking at, up leveling our care and adding additional services. Okay, so this is a book that I quote a lot. It's all about how to make change stick, how to change things when change is hard, and certainly that is real in a dental practice when we're making changes. I mean, think about if you're doing same day crowns, right? If you've incorporated CERAC technology or milling technology in your practice, That's not an easy change. It's not something that the doctor takes lightly. It's not something that all of a sudden on day one they're super confident, right? So think about some of these things in your practice that your clinical leaders have implemented or things that you've done in the past and build on the confidence that that brings. We always have to start somewhere, and we've got to, take time to really learn and believe in the products that we are recommending. So they say for change to really stay in place, three things have to be in alignment. One is the emotional mind, one is the rational mind, and the other one is the path. So all three of those things have to be in alignment in order for change to really take place and for it to stick. And we see this happen all the time in ourselves, right, as coaches, because we're also all hygienists and we've done this before in our practices, but also with our clients. So that rational mind is the part of our mind that you're going to hear tonight. You're going to say, oh, that's really interesting, these products, and I see there's some science behind that. All right, so this is something that I might want to consider. And then you have the emotional mind, and the emotional mind is that heart, it's that conscience, it's that piece that says, is this really the best thing for my patients? um, is this really worth my time to incorporate this, and do I really believe in the value that this is presenting, and is the value of the service, does it outweigh the cost for the patient? So all those things grow through our emotional mind, right? So those two things have to be in alignment. And he uses this analogy of the elephant and the rider, and he says that the emotional mind is is represented in this image by the elephant. And the reason is because, our rational mind, the things that we know we need to do intellectually, um, those can kind of go out the window if our emotional mind is not in alignment, right? The elephant is going to go where the elephant wants to go. That rider might think he's in charge of the elephant, but if that elephant sees something and it really scares him, or he decides he wants to go over on the side of this little road here and chomp some of that grass, the elephant's going to go where the elephant wants to go. And the same is true for our subconscious, our emotional mind, right? We've got to believe in our heart that what we're presenting is in the best interest of our patients. And then we have the path. And the path is our circumstances, right? Our situation. And in a dental practice, in a hygiene department, very often that path is our schedule. So if, for example, we're working to elevate our diagnostics for periodontal disease and elevate the level of periodontal therapy that we're providing in our practice, and we have nowhere in the schedule to put it, it's going to be an obstacle, and it's going to be something that's out of alignment. It's going to make it very hard to implement that change. So just wanted to give you some context and some things to think about as you're implementing some of these things in the practice. So let's talk about some of these products and services that we're seeing that are very innovative, effective, and some of these are going to be things you've heard about in the past. Some of these are going to be things that are new. Obviously, one of the number one things that we work with clients on is helping them develop and implement a foundational periodontal diagnosis, enrollment, and therapy protocol. Now, some teams already have this in place, but for whatever reason, it's not being implemented, or maybe it was created a long time ago and they have a lot of new hygienists there, or maybe it's outdated and they want to refine it, or maybe they have a foundational protocol in place and they say, you know what, it's time for us to really take this to the next level and get everybody on the same page and add some adjunctive services that are going to enhance the results of our non-surgical therapy. Okay, so that's one service. That might be where you start, is to just really look at refining your periodontal diagnosis systems and saying the service that we're really going to focus on in 2024 is non-surgical periodontal therapy, and making sure that we're addressing our patient's active disease, whether that is treating that in your practice, whether that is referring out to your periodontist, whatever that might be. And it's probably a combination of those two. That absolutely can be your direction for expanding your hygiene service mix is even just with that alone. And then what we help teams do is, once they have that foundational piece in place and that's running along smoothly, then we say, hey, now is time to really look at what could you add? What could you add that would enhance the effects of the non-surgical therapy. What could you add that would help patients in perio maintenance that perhaps have, one or two areas that are flaring up with periodontal disease that we want to really address? What could we use that's going to be valuable to the patient and is going to create a positive clinical outcome? So here's some things that we've been recommending. So obviously you're familiar with Arrestin as far as an antibiotic, right? That's actually going to reduce inflammation in that periodontal pocket. Some of you might be familiar with PerioProtect. PerioProtect is a set of custom trays that are made with a seal that hold a peroxide solution down into the sulcus that's going to kill bacteria. Many of you are utilizing laser therapy, whether that's, we have some periodontists on the line that might be using that as a surgical procedure. Some of you are using it to disinfect the pockets. Some of you are using it to do curettage and remove some of that diseased tissue. Microbial testing to really get a look at what are the pathogens that are present and at what level, and how does that affect how we are treating periodontal disease and how the body might respond. And then also there's a new product that's out called Hygiene. I'll share a little bit about that with you in just a moment. So Hygiene is another type of solution that can be placed in the pocket at the time of scaling and root planing. And then there are some new regenerative products. One of them that we are super excited about is called Cure Repair. And Cure Repair is an incredible product. We'll dig into that in just a moment. And then obviously we have our home care products. Cure has a protect, a preventive product. You have your Sonicare, your Power Flossers, your whitenings. And then don't forget about some of those complementary services that you're doing. Maybe you're using an oral cancer screening light and you're doing that complementary. Be sure that you are letting your patients know how well you're taking care of them. So it's not unusual. I've experienced this. A patient will come in and I'll do an oral cancer screening and they'll say, oh my gosh, nobody's ever done that before. But this patient's, maybe they're in their 40s or their 50s and we're the third or fourth dentist that they've ever seen. Likely someone has done an oral cancer screening and either they just didn't tell the patient or they just don't remember. But every time you're doing this, make sure you tell the patients even about the complementary services that you're offering, because they won't know otherwise. They don't know when you pull their tongue out that you're doing an oral cancer screening. So just be sure to highlight that as well. Okay, so some of the products that we mentioned, right? We have our periodontal, non-surgical periodontal therapy up here on the left. This is an image of the PeriProtect trays. Hygiene, it comes in a syringe. Hygiene is, they have named it, or they've termed it a desiccation shock therapy. So it is a solution. It's very simple to place in the periodontal pocket. And what it does is it eradicates biofilm in that area where you're placing it, but it protects the tissue that's there. It destroys harmful pathogens and that sticky matrix, that biofilm matrix that they're in, so that the tissue can really begin to heal. It's quite affordable, it's easy, it's pain-free, it's something that you can place even before you do the scaling and root planing, and it will help desiccate the tissue, the calculus, and make it easier to remove. This is an image of the Cure Repair, and it comes in, this is the box that the applicators come in. So it has a small applicator, and within it is a matrix. We've got another slide. We'll go into a little bit more detail on this. And the point tonight is not to educate you in detail on every one of these products. It's really just to introduce these things and give you some context with how you can implement some new services and be successful. We also have an image of the Microbe Link report. This is actually a patient education document they have right now. They just released these. If you go to Microbe Link DX, go to their website, you'll see they have a couple really great patient education tools that you can download on how to understand their result. And there's another one on why do I need microbial testing, right? What are the benefits of this and how to explain that to patients? So really great resources there. And this is an amazing service to really identify what bacteria are there, and then come up with a plan to really attack that and reduce that bacterial load with the patient. Just an example of a laser, non-surgical, hygiene laser. And then obviously we have our Arresta as well as a great resource for very site specific, in my opinion, very site specific inflammation. Great way to reduce bleeding and inflammation there as well.
Rachel, we had a question from Christine about how to, they have the testing for microbes and how to get more information on how to explain that to the patients, and that resource would be great. So I asked her to
Yes.
contact the company. They might even have some training they could do virtually for that.
Absolutely. And I will tell you, MicroBlink DX is a phenomenal company. And one of the things that makes it so great is the support. So today, I was flipping around trying to find some images for you guys, and the chat comes up, and I immediately type in a question, and it immediately gets answered. And the owner is a hygienist. She's amazing, and she's very engaged, and their customer service is incredible. So yes, those two resources would be super helpful, and they're right on their website. So I would encourage you to check that out. Great question. Thank you for that. Thanks,
Awesome.
Kelly. So this is Curodont from a company called Vivardis, which is out of Switzerland. This is new to the U.S. Hybenex and Curodont are both new to the U.S. in the last 2 years, but the Curodont has been in Europe for many, many years, and there's quite a bit of clinical research on this. And what we do when we present things to our clients, because I will tell you, as you all know, there's a big variety of, I would say, um, evidence-based um, evidence-based information that dentists need to feel confident and ready to integrate a product. And I give you guys kudos for that, right? Because this is your reputation. These are things that you're presenting to your patients, and you want to make sure that they are um, they do what they say they're going to do, right? That they're backed by a clinical research and evidence, and also that you're going to have a great result for your patients. Your patients are going to be able to have a good experience with this. So some clinicians are going to say, "Hey, we're going to do a training with the team at this company, and they presented us with a couple research articles. We've reviewed those, and we feel comfortable to move forward." And others say, "I need more information," and it's okay. Wherever you are on that spectrum, right? This is your clinical practice, and talk about that with your team, and reach out to those companies if you need more. Uh, Clinical research, reach out to them and ask what they have, and then make your decision based on that. Our job is to present what's available, and then for you guys to make a decision on what's best for your practice. And I also will say this absolutely is not a complete list. This is just a tip of the iceberg as to what is available. I'll encourage you to keep an eye out. We'll share it on our Inspired Hygiene social media. But last year I joined the panel for the Celerant. Celerant Consulting is a consulting company that works with dental manufacturers, and I am on the panel for the Celerant Best in Class Dental Hygiene Products Awards. So we're at the point right now where we're voting for the 2024 award winners, and you'll start seeing those things come out on social media, and you can follow the Celerant social media sites, and you can see that. But they have Celerant Technology Awards, which are primarily dental technology, and then they have dental hygiene best of class awards. So keep an eye on that, because these are hygienists that are on this panel. Most of them are clinical active, still clinical active. There's a couple of us hygienists that are consultants as well. And just keep an eye on the products that are coming out, because we have all vetted those products, really looked at them in detail and discussed them, and they're always very innovative. So this is certainly not an all-inclusive list. These are just some things that are great to look at now. Curodont. Curodont is a biomimetic system for guided enamel remineralization. So this is perfect for those watch areas, right? You know it's not something's going on with the enamel. There's some changes that you're seeing there, but it's not ready for restoration. And so what Curodont can do, and you can see the applicator here, it's super, super simple, no taste, no pain. It is a liquid and a peptide, and what it does is it goes into that area. You place it on that area where you know that there is some breakdown of the enamel, but you're not seeing a cavitation yet. And it creates a scaffold with those peptides, and then it pulls the hydroxyapatite from saliva and rebuilds the enamel in that area. And there is quite a bit of research on this. And I think, yeah, here's some references down here. And I think Jennifer may be dropping that into the chat as well. And you can go look at those. There's X-ray evidence of remineralization even in some of their research studies. So check that out. It's a really innovative, amazing product. And there's a new ADA code for that. Jennifer, can you review this for us real quickly?
Yeah, absolutely. So this year, we have a new ADA code that is to be used for Curodont. So it is D2991. And you'll notice here in the description, they talk specifically about that scaffold to guide the hydroxyapatite regeneration. So that is very important that we're making sure that we use Curodont. And there is going to be other products down the road, but that is the current one that we have here now. This screenshot here is actually from Practice Booster. If you don't have Practice Booster, it's an amazing tool to use, especially when you're submitting to insurance. It just gives you an idea as to, the red here and the warning, what you need to watch out for in any areas, just so you make sure that you get the best coverage that you can. We are seeing that there is quite a few plans that are covering this already, some Deltas, some Medicaid. So it's looking pretty good. And they're covering it usually twice a year in most cases. So definitely be on the lookout for that. Ask if you're doing insurance verification, if they're covering that D2991 and what they're covering that at. But definitely huge news for Curodont to have that new code, especially only being here for 2 years in the US. So amazing.
Yeah.
Yeah. Mm-hmm.
Thank you. I'm looking at the questions here too. Yes, so the question was, does the material have to be specifically placed by the dentist? So obviously, you always want to check your state requirements, but in general, if you're allowed to etch, you can place Curodont. So it is something that can be placed by hygienists. It's very fast. I've done it. Takes about the thing that takes the longest is waiting for it to dry. So you have to isolate the area for 3 to 5 minutes, but it's very simple to place, can be done same day when you identify some of those watch areas. And one of those applicators can treat up to 3 sites. So it's certainly more affordable than, a restoration if it's something that we can head off and not have to wait, for it to, go to the next level where it needs to be restored. So thanks for that, Jennifer. All right, and then one other tip you had for us.
Yeah, absolutely. So speaking of ADA codes, there has been quite a few new additions and changes in your ADA codes for 2024. So a lot of the practice management systems that are out there have a tool that you can run that will update all of your ADA codes for you. So it will, delete some, add some, make sure that your descriptions are correct. So definitely look into that, make sure that you've updated those. And another new thing that ADA did, they've been very, very busy this year. There is a new 2024 submission form. And one of the sections that's new is the box 39A, the date of last SRP. So I know when I was submitting insurance before, you always put it down in the remarks section. But this is a big step forward for obviously for perio too, but it's making sure that we have all of the information and that there's specific places for everything. So just make sure you keep an eye out on that and that you are using the new ADA form. Don't worry if you're not yet. There is, they give you a little bit of time, but just to be on the lookout and make sure that you take a look over that and that you're really training your team and make sure that your practice management system is ready and prepared to be able to utilize that.
Awesome. Thank you, Jennifer. Appreciate that update. Good little nugget there. The other thing I would say, and Kelly, actually, why don't you share your experience? I'm going to go back a couple slides. Just hang on a second. Actually, I'll come back to this. This is a good spot here. Kelly, you're going to share a little bit of your experience with a client if you can give us just a little bit of, tell us a little bit about the practice and how you introduced Curodont specifically and what worked well, what are some of the obstacles, and I'd love for you just to share a bit.
Okay. Well, it's very important not to get overwhelmed. We don't want you trying to introduce all these products in a short period of time.
Right.
So at our second visit with this particular practice, we introduced Curodont. It's a pretty heavily PPO insurance driven practice in New Jersey. They have two hygienists. One of the hygienists had been out of school maybe 6 months. So they we went in for the second visit. We had this plan. So what we did first was we introduced the product. We have some of the product that we take with us as coaches. I had set up a 30-minute training with the representative from the company. They have great resources and great slides on exactly how the product works, and how you can implement it in a workflow, basically. And we then discussed when we were going to identify the patients. We made a goal as to how many patients we were going to identify per day. We discussed pricing. In this particular practice, they charge $89 per site. So then we went hands-on into a treatment room. The doctor actually was our patient, and we got to feel the product, we got to use it, we got to see how easy it was to place. And so it was a great experience. And that team, they have done amazing. My visit was early in August, and last year, in 5 months, they had I believe $4,200 in production. They had placed 48 sites of Curodont. And it was interesting. The younger, the new graduate, she was a superstar. She was doing great. So we also had check-ins. Every couple of weeks we have meetings with our teams, and we would say, "How's it going? What obstacles have you had? What are your successes?" So we got to celebrate and encourage them throughout that process. So it was a great time. And as a coach, when we are able to help the patients and the practice, that's a great feeling. I feel like some obstacles that we have seen in a couple other offices was maybe a couple or one or two hygienists were not, they didn't really believe in the product. So, and this wasn't necessarily Curodont, but if they don't know how it works and if they don't believe in it themselves, they're less likely to even, they'll make excuses as to why they don't even want to start to implement it. So, identifying those practitioners and what do they need, what more how can we help them with more information, what videos can we send them just to help them know that these are great products. They've all been they've had studies done, so we know that they work. And so what can we do to get everyone on board, because we want the entire team to really believe in these products and to be offering them to the patients as well. I think you're muted, Rachel.
I am. Thank you. I would say if you're on this meeting and you have felt that way in the past and you think, gosh, I don't know if I believe this, I don't really want to do this, I would encourage you to voice that. And I'm assuming that you're in a practice where it's a safe environment and you can voice things like that. But I would encourage you to voice that and just share, I'm I'm open to learning and growing. I'm just not sure I'm on board yet and I need help. So I'm going to do a little more investigating, because you want all of your practitioners and providers in your practice to be fully on board with what you're providing and believe in it. Because here's what happens, if they don't, right? Is they may feel some pressure from the clinical leader to do this, and then if they're not fully on board, it will last for a little while and then it will slowly fall away. You'll just notice, hey, we're not mentioning this anymore. What's happening here? So that's really important. When you start to see that happening, that's a time to bring it back up. hey guys, so I'm noticing we were doing really well with this particular service, and now I'm not even hearing about it anymore. So where are we with that? Did we? And sometimes it's we got a denial from an insurance company, and so all of a sudden our knee-jerk reaction was just to back away from that instead of investigating and saying, okay, well, did we miss something maybe in our documentation to the insurance company? Is there something that we can do better? Did we communicate that in a way that maybe wasn't completely accurate or whatever it might be? Like investigate that, check it out. So when you say check in, I love that, Kelly. Yeah, check in every couple weeks. How is it going? What's our patient's response to this? And what are the results? And with something like Curodont, right? Or even Protect or laser therapy or things like that, it's going to take some time for you to see clinical results, right? It's not something that the patient's going to come in 2 weeks later and it's going to be just an amazing, response necessarily. It's going to take some time. So pay attention to those things and just know when patients come back in, know what we did last time and evaluate it so that we can give the patients that feedback, and that helps create confidence for them in themselves and the decisions they made, and also in us. And then it also share those results. If you're seeing, wow, like you had 20 bleeding sites last time, and now you went through not periodontal therapy and the laser therapy, and now you have 2 sites. I mean, that's an incredible result. And then share that with the team, because your team needs to hear that positive feedback. Remember, those positive patient outcomes drive business outcomes. So that's what we're focusing on. So yes, you want to see like how many sites did we place and how did that affect, our production, but first and foremost, and more importantly, what is the value that the patients are getting from that? Thank you for that, Kelly. That's great.
You're
I love
welcome.
those just real life shares. Okay, so I want to go back a slide to the standard of care document, and I'm going to share with you how you can get access to this. This is a really great worksheet to help you um, establish a standard of care within your hygiene department, and you could take this as a launch pad for other procedures and services in your practice. But let's say you're going to incorporate one of these into your care, and you're doing all the things that Kelly said. We're going to give you a resource for that step-by-step way to integrate. But you're doing all those steps and we're seeing good results and we believe in this. What I would encourage you to do is add it to your standard of care, right? So when we see this, we're going to do this. We're going to recommend this. And when we see this, we're going to recommend this. So that you have it written so that when something happens and maybe, we kind of fall off track with that particular procedure, we can go back to the standard of care and say, okay, so we agreed on this, and this is a collaborative exercise when you're creating the standard of care. And this may take you a couple settings to do this together. But we created this, we agreed on this. So tell me what's getting in our way of implementing this so you can really have some open conversations. And this is just an amazing tool to have in your practice for, agreement on how often are we completing doing a complete periodontal evaluation and charting. How often are we taking blood pressures? What are the radiographs? So there's a lot of things on here that will really help you set some clinical standards within their practice. Super helpful. Okay, this is a resource. Everybody that's on here live, you're going to get one email with a link to the recording, and also you're going to have a link to this implementation worksheet. So it's going to give you on the following pages of this worksheet step by step on where Kelly said, hey, you're going to, she described we called the rep and we set up the educational session, and we went through that and we ordered our supplies, like all those different steps. So it will kind of guide you through implementing and integrating whatever service you decide to start with. All right, communication, this is really important. So how many of you, I would love to see in the chat, just say yes or me. How many of you have had a friend say to you, oh my gosh, yeah, I went to the dentist and they tried to upsell me on everything that they had there? How many of you have heard that? I'm going to say me. Yep. And does it make you it hurts my heart, right? Because we know that that's not the intention. We know the intention is to offer patients things that the dental team feels like are valuable. But what does it do? It creates a negative vibe. It creates a negative perception from that patient of the dentist. And so many of us have experienced that. And so here are a couple things to think about, because nobody wants to be that dental practice, right? We don't want to be the dental practice that, people think is upselling, because that gets around, and it's just not what we're going for. So here's what I would say is start with really employing your skills for critical thinking, right? These are your clinical skills. These are the things that in dental hygiene school and in dental school, right? We spent a ton of time just observing what was going, we spent an hour for every hygiene appointment in hygiene school on what am I seeing in this patient's mouth, right? And thinking about these things. How does what I'm seeing on their medical history line up with what I'm seeing in their mouth and what they're telling me either they're concerned about or they want for themselves in their dentistry. Okay. So put on your critical thinking hat and really start to think about, based on what I'm seeing in this patient today, what is the most urgent? What's most urgent? Maybe they tell you their mouth is really dry. And so you've got a product, you've got Elevates all day spray. You've got a product that you can recommend for them that's really going to make a difference. So you might not recommend for other things because that's the thing that you're focusing on. That's the triage. So triage is really identifying what is the most urgent need today and how can I bring value to the patient by focusing on that and giving them a solution. Okay. So think about what they're experiencing, what their concerns are, what you're seeing with their oral conditions and with their medical history and their concerns. Photos. So, for example, if you're going to use adult fluoride and you think that that is important for this patient because they have recession, then take a photo of that and put it up on that monitor, right? This monitor right here, I guarantee you, is not used as much as it could be in probably most of your practices, just based on our observation. This is one of your most important educational tools right here. Aside from yourself, this is it. So have an image up here of that area where they have recession as you're beginning to talk to them about the service that you're going to provide. Make it personal to them. So instead of saying, we always recommend fluoride. Well, that's where patients feel like it's just a blanket recommendation. Instead, say, what I'm noticing is your gums have pulled away to where I'm seeing some of the root surface and there was some plaque there. And those two things combined could create a big cavity there that could get away from us really quickly and create a big problem. So one of the things I'm going to recommend is that we address that and apply some fluoride there that can stop the progression or prevent some of that decay, that cavity there in that area, or whatever product you feel like is going to be the most effective there. Okay. So make it personal, and then look at what is most important for that patient today based on your clinical skill and judgment, right? If you've done a sleep apnea screening today, you might feel like what's most important is having a conversation with the dentist about, a sleep study. And we're not gonna, present them with all these other options. Now, I mean, obviously there are times that it warrants multiple services. I'm not saying that it's only one thing at a time, but what I'm saying is don't take away the message here tonight is not that we're making a list of all the things that we could provide our patients with today and we're doing it all at one time. That's not going to be effective. We've really got to use our clinical skill and judgment to make sure that we're making it personal, we're addressing what's most important, and we're using the educational tools to make sure that the patients know that this is about them and it's not about us and what we want to do. Okay. Jennifer and Kelly, anything you want to add to that, or Catherine or Connie or
I think
anybody else?
I think it's important to, if you get a lot of no's, like really pay attention to what you're saying. I've recently, personally, I was going to purchase two different things, and I'd said yes, and the person said, "Oh, it's real expensive," and I immediately thought, "Can I get this somewhere else? Do I really need this? Do I need to go to Walmart? Can I go to Amazon?" So if you're getting a lot of no's, just listen to what you're saying. And if someone else is getting a lot more yeses, listen to what they're saying,
For sure.
because we can
For
always
sure.
improve.
Yeah, for sure. I love that. I always look for people that are superstars at one thing or another, and if they're having really great case acceptance, don't ever take that, as oh they're better than I am or anything like that. That's not what it's about. They've just found some technique that works, and to learn from them. Practice leaders set up an in-service training, and if there's someone that's really great at taking great bite wings, have them train everybody else. It's not about and we never present when we come into coach teams, we never present as you're not doing this right or there's something wrong here. It's always, hey, you have a great foundation. Let's build on that, right? Let's refine and tweak some things so that you can see exponentially better results. And that's really what this is all about. So thanks for sharing that, Kelly. Yeah, listen to what you're saying, because sometimes those things are gonna hold you back a little bit. And also, what are you saying that's working really well, and keep doing more of that.
Yeah. And
Okay,
we're all human.
so
You'll have minutes. You'll have
absolutely.
times when you say, you're like, what was that? It's okay.
Exactly, right? We say, "Oh, you have a little bleeding," or something like that. Um, I catch myself too, and it's something that we always have to kind of work on retraining ourselves. Um, Thank you guys for sharing some of these things. Yeah, we're big fans of GBT as well. I think keep an eye on that for sure, because it's a really amazing way to transform the hygiene experience, patient's hygiene experience. Okay, so here's what we would love to share with you. We're going to send you with that recording link, uh, um, the resource, the resource for implementing new services. And then we also want to give you access to this attendee resource page on our website. And I'm going to show you how to get that in just a second. But there are a lot of things here that can really help you. The standard of care worksheet that we mentioned is on there. We have a perio calculator tool, so you can calculate your perio percentage. If that's an area that you say, hey, we've been working on this, and I want to see how we're doing. I want to start tracking that. You can also look to see what is your potential in your practice from a very conservative standpoint on non-surgical therapy. We want to give you our 17 tips to attract hygienists to your practice. And this actually is a really great practical guide for evaluating your ads for any role in your practice. So you'll be able to click on that and access that. And then you'll actually see the March flyer here, and you'll be able to register for the March event, the March Growth Forum. We're going to talk about, are there some things that are happening in the hygiene department that are creating risk for the practice? So we're going to dive into that. So you don't want to miss that one there. And so here's what I'd love to ask you guys. We're about ready to wrap up. I've got one final thought that I'm going to share with you. But I would love it if you've gotten one thing that you felt was valuable. Would you just drop the word yes in the chat? If you've gotten one thing that you felt was really valuable from tonight, we'd love to hear that. And thank you so much for that. We love doing this with you guys, and thanks for joining us. All right, so here's what I'm going to ask is we love to get feedback from you, and it's a great way for you to, we thank you for being here. For you to thank us is to give us that feedback. And so here's what I want to share with you is if you would please just take this short 2 to 3 minute survey. Now in the chat, Jennifer is going to drop the link. So you can click on that link and it's going to take you to that short 2-minute survey. We're going to ask you a few questions. Give us some feedback on what you liked about tonight, because we're trying to improve these. Feedback on what you think we could do better. If there's topics that you would like to share with us, put those in that feedback section. So she's going to drop the link in the chat. You can click on that and do it on your computer, or if it's easier, you can grab your phone and you can scan this QR code and do it on your phone. Make sure you enter this word bonus so that you'll be taken to that attendee resource page. So I'm just going to give you a couple minutes to do that, and then I'm going to finish with one final thought for you. I'm going to share with you some resources of how you're going to see great business results with adding these services, some before and after of hygiene schedules and production comparisons.
The code is bonus if anyone's looking for that. BONUS.
Can you see that on my screen still, Jennifer?
Yes.
Okay, great.
2 years. Oh, it's been 2 years.
All right, when you're done, everybody type in done. If you can just type done in the chat.
Lots of dones. There we go.
Awesome. Thank you guys so much. Appreciate that. So when you're done with that survey, just type done. Awesome. I see those coming in. Thank you so much for that. Super helpful. Okay. So I don't know about you, but as a hygienist years and years ago, I felt like I was stuck on the prophy trap, right? Before I really was awoken to the power that the hygienist has, the impact that we have the opportunity to make in our patients' overall health, and how it's really our job to step into that role as healthcare provider. And we see this all the time with the clients that we work with. They're stuck in that prophy trap and they're ready to get out. They just don't always know how to break that cycle. And so, expanding your hygiene service mix is a perfect way to do that. It's a first step, and it creates a win for the patients because they're having their needs addressed. There are solutions that are available to them. It's a win for the practitioners, right? So as a hygienist, it's more exciting to be able to offer multiple services than to do a prophy all day long. And it's a win for the practice, right? Because we're serving our patients, we're developing a great reputation in our community, and it also is more productive. So what we did, just to leave you with this, is we did a sample schedule. If you want to take a screenshot of this or take a picture with your phone, you're welcome to. I know it's kind of small and it might take a little bit of kind of studying. But what we did is we took two schedules that were very similar. And what you'll see on Hygiene 1 is it's very prophy, right? Recare heavy, right? We've got prophies, we've got child prophies, we've got a couple perio maintenance. And then on the left, what we have is we have a scaling and root planning visit. We have child prophies with Curodont. We have perio maintenance with some microbial testing here. We have in the adjunct section on Hygiene 2 at 12:30, we have PeriProtect trays. So you can see how we've incorporated and integrated some of these services here. And obviously you're going to have days where you've got holes in your schedule and you've got days where you're on fire and other days where you might do one or two of these procedures. And that's the best way to start. But you can see the dramatic impact that this makes for patients, for providers, and also for the practice. And so we're going to leave you with that. We are happy to answer questions. If you want to ask a question live, just maybe raise your hand and we'll unmute you, or you can unmute yourself, and we're happy to answer any questions live that you might have. If you don't want to type it out, we're willing to hang here with you if you have any additional questions. SDF versus Curodont. Good question. So in my understanding, and this is a question that I would ask when you engage with the team at Vivardis, because they can explain it in a lot of detail. So I think there's still a place for both. One thing in my understanding is SDF can be used in open cavitated lesions. It can be used there and will arrest caries there. Curodont needs some enamel around that, right? It's not going to be able to fill a huge gaping cavity to create enamel regrowth. So that's one difference there. The other nice thing about Curodont, though, is it does not leave, it's not staining. So it's clear, there's no staining to the tissue, it regrows enamel that way. And those are my, just, I would say, basic understandings of the difference between those two. So there's still a place for both, absolutely. Any other questions? Oh, and let me share this too. If you want to register for next month's session, you can go ahead and scan this and register for next month's session. We're going to be talking about, is the hygiene department creating a risk for the practice? What are some of those things that maybe we may not be paying as close attention to as we need to? that might be risky for the practice. Happy to answer any other questions. Thank you. Jennifer just dropped the link as well in the chat to register for next month. Looks like we've got somebody that's just joining us. I saw someone that just joined us and we're just about to wrap up. So we started at 7 o'clock Eastern time. But if you're on here live, you'll get a link to the recording. You can watch that later. Thank you guys so much. Do we have any? I don't see any. Do we have any hands raised, Jennifer or Kelly, for any other questions? Any last thoughts?
Nope, doesn't look like that. Nope.
Awesome. Awesome. Thanks everybody for being with us.
Thanks for joining.
Have a great week. If you're at Yankee, please be sure and drop by Jennifer and Emmy's sessions, and hopefully I can see you around the exhibit hall and say hello. Thanks everyone.
Bye.